New York, and on the new Hot 97 app. Ebro in the morning on Hot 97.
It's Ebro in the morning. Laura Stiles, Rosenberg. Give it up for today's guest, Van Jones.
Yeah, Van.
The well-dressed, always informative Van Jones. How you doing, sir?
Hey, look, I am safe, I am supplied, and I am symptom-free.
There it is.
I check that box those 3 boxes, and I'm good.
So I would say maybe a week ago, maybe more, you put me in a group text email with some other media individuals to begin sharing videos that you all were receiving from inside prisons around the nation with people not being properly prepared in prisons to deal with COVID-19 and how ill-prepared we were as a nation. You wanted us all in the media to start sharing this information. We've had lawyers on. We've had, other people on to talk about what's happening in the prisons and just in society in general. And we wanted to have you on today to get a first account from you and the Reform. And on behalf of the Reform Alliance, the work you guys are doing in prisons and and how we can help as the public.
Well, listen, I appreciate you for raising the alarm. Obviously, we're in the middle of a pandemic and a plague. The epicenter of the pandemic is now the United States, and the epicenter of the epicenter, jails and prisons in the United States, because people in jail and prison cannot socially distance. They're packed in there like sardines. The virus moves at 5 to 15 times the rate through a jail or a prison. What that means is that, whether you're talking about Rikers, whether you're talking about the Cook County Jail in Chicago, whether you're talking about, the 10% of all of the virus cases in Arkansas are in jails and prisons. So we have an emergency in our jails and prisons. The Reform Alliance has been working to get people out. We've worked with about 24 governors plus the White House. We've got about 33,000 people on track to get out. We're very proud of that as a Reform Alliance, working with our allies. However, there are 2.4 million people who are behind bars. So even if we get 100,000 out, you still got literally millions of people who are behind bars. And so we've rushed, 300,000 masks in to prisons and jails across the country. But what we need the public now to start demanding that the elderly prisoners, the sick prisoners, I say prisoners, I mean human beings behind bars, and those in for minor offenses, drug offenses, probation, stuff. Any arrest right now can be a death sentence. Any little minor charge, any parole violation for being late for your meeting, not paying a fine, can be a death sentence. So we want them to stop putting folk in jails and prisons for a little minor nonsense. We want them to bring, sick, elderly, and people with minor charges out, and then to rush medicine and masks in. That's what the Reform Alliance is calling for. ReformAlliance.com is where people can plug in. And because, we do have this national network from when we were fighting to get the First Step Act passed 2 years ago. We got, as you know, we got folks inside the prisons who we're in contact with, some above board, others with stuff, with cell phones and stuff they may not supposed to have, but they, people have what they have. And we're just trying to raise the alarm. And I appreciate you for putting the spotlight on this. It's so easy for folks to say, listen, I can't even find diapers. I can't even, I just lost my job. I can't care about folks behind bars. What you have to understand, 3 things. Number 1, you do not want, I don't care who you are, jails and prisons across the country turning into morgues over the next couple of weeks. It's just a moral disgrace. But number 2, you cannot stop a plague outside the prison and let it run inside the prison, because guards and staff and food services come in and out. You've got to be reinfecting your own community. And number 3, people not good at math, but let me tell you this. When you have 2.4 million people in prison getting sicker quicker than everybody else, if those 2.4 million people all have to come out and go to the hospital, you can't go to the hospital. You'll knock out the entire
because they don't have hospitals and jails that can take care of this.
Yeah, they don't. Ain't no respirators in no prison. Right. And so for moral reasons, for practical reasons, and just for public, just if you don't want to knock out every hospital in America, we need to immediately, aggressively try to shrink the prison population and do better by the folks who are behind bars. Otherwise, all of us are going to be suffering.
Van,
Van,
obviously people are. Oh, go ahead, Laura.
so for clarity, because I know when you're asking the public to get involved, and I know a main concern of people is that when you say, oh, we want to let prisoners out, is they're like, wait a second, the last thing I need is to have my life in danger, right? So we've had that conversations of elderly and people that have done, of course, nonviolent crimes. But we have had, I don't remember, do you guys remember the name of the guest that we had who was trying to break it down? And he said, yeah, it's not all nonviolent offenders. There are some violent offenders that will be let out.
We had a colleague of mine who's a lawyer. Obviously, he's a defense attorney, so his passions were not just for nonviolent. So that was one guy. I think I don't know, Van, you want to speak on behalf of the Reform Alliance? You guys are a little bit more focused on a specific group.
Yeah, where do you guys draw the line on who you focus on, et cetera?
Right.
Well, listen, we don't want for a situation to happen where you let people out who are not going to do a good job when they come out, and then suddenly they say, okay, we'll put everybody back in. And so what the goal would be to reduce the number of people behind bars to a point where the people who do need to stay behind bars for whatever reason can be housed safely. In other words, right now you can't have isolation quarters. You can't, listen, let's just be honest. There are some people who, if they came out, they might pose a threat to themselves or others. And that's really the size of those people. It makes sense for them to be confined. The Reform Alliance has never said everybody should come out of prison. But what we have said is nobody in the United States of America has been sentenced to die from a virus. I don't care what the charge was. And so the idea that we're going to sit here and let 100,000 people die in our prisons, that doesn't make any sense. When you can safely reduce the prison population, nobody thinks that people 65 years old, 70 years old, people who are desperately sick right now pose a threat to anybody. If we could focus on people we agree with, we could shrink the prison population substantially, and then the people who are behind bars, we could be able to deal with them in a humane and smart way. It doesn't have to be.
So for when you say elderly, you mean people that are 65 and older?
60 to 65 and older. Different states have different definitions of that for compassionate release. But yeah, so statistically, what you're seeing is, what's amazing is statistically, a lot of people could probably come home safely, be on home confinement, et cetera, because statistically, over 60 years old, you're not committing crimes. So you're just housing people because you're mad about something that happened 30 years ago or 40 years ago. But from a public safety point of view, a lot of people could come home.
Well, there's 40,000. Isn't there 40,000 people in jail just for marijuana?
Yes, there are 40,000 people who are in prison across the United States for marijuana only charges. There are people who have marijuana plus, but you could do 40,000 people right now who have marijuana only. They ain't got nothing else.
Non-violent.
They ain't got
nothing
they
else.
ain't got no jaywalking
Weed
charges.
only.
Weed
I
only.
agree 100% with that.
That's easy, man.
Yeah, listen, weed only. They ain't got no jaywalking charges. They ain't got no overdue library book.
Right.
They
just smoked a joint or had some weed or too much weed.
You know what I mean? So
yeah, that's completely different. But when we're talking about rapists or child molesters, that's a whole different conversation for me.
Yeah, listen, different people in the criminal justice movement have different positions. Some people say that we should abolish all prisons, that we should let everybody out of prison and deal with the whole situation differently. That is not the position of the Reform Alliance. The Reform Alliance has a position that there are literally you probably have 500,000 to 1 million people who once you start dealing with these more minor charges, you got people cycling in and out of prison. We have people die. We've had people literally die in this pandemic over a probation or parole violation. Somebody who was home, who had not committed any new crime.
But they can't. They're cousins to a gang member, so they came in close proximity with a gang member, went back to jail, caught the COVID,
and now are dead.
Right.
And now are dead. So rather than trying to have a philosophical, though very important argument about should we have half the prison population smaller than it is on a regular basis, or only 10% or 0%, that's really important. But right now, if we could just get the word out, most people would agree. If all you have is a probation or parole violation because you went to the wrong neighborhood to check on your aunt, you weren't stealing nothing, you probably shouldn't die in the middle of this thing. So what we're saying is, let's come together where we agree. There are probably 500,000 people might be able to come home safely and intelligently. We don't know what the exact number is, but the criteria would be if you're old, if you're sick, if you got a minor charge, let's send those people home to home confinement. And then the people we leave behind now, we have a manageable population. Let's treat them humanely. Let's rush in medical supplies. Let's let them socially isolate. Let's get them soap. Let's get them hand sanitizer. Let's do what we're supposed to do and not have people dying who over this virus. And by the way, save your own life, because you cannot defeat the plague outside the prison. If you let it run through the prisons, then it's going to go through the prisons faster.
Van Jones, you have been very vocal also about working with both Republicans and Democrats on the First Step Act.
Yes.
You caught a lot of heat for that, but you've clearly stated to people several times, listen, I've been working since I was before I was a public person. My primary focus has been dealing with justice. And
since 1993, when I got out of Yale Law School and moved to Oakland, I've been suing cops, trying to close prisons. The Ella Baker Center for Human Rights, which Diana Frappier and I started back in 1996, still open for business. We closed 5 abusive youth prisons in California by the early 2000s. I've been woke before folk had alarm clocks that like to criticize me.
But now because you had a sit down with Jared Kushner, and the First Step Act, which you helped champion, was both endorsed by Republicans and Democrats. People look at you sideways sometimes, and you catch these flames out here, which you don't mind.
Don't mind at all.
But I do want to delve deeper into what this means to black people and black and brown people in America, because we had the crack epidemic, which was not dealt with like it was a health issue. It was dealt with as a criminal issue. You had obviously redlining and other things that have happened to black people on the real estate end of things, not getting loans, which has just been straight racism and economic racism. And now here we have a global pandemic, which because of joblessness and education, racism, and other issues that black and brown folks have dealt with this in this country. Now you have this disease moving through our communities faster and hitting harder than it is other communities because of what we've dealt with generationally. I would love to hear from you how you believe we are going to address this, what many people have called a state of emergency.
Well, it's beyond a state of emergency. And part of the thing is, I've been black a long time.
You don't say.
How long exactly?
Well, look, about 51 years. Look, for one semester in college, I was really into U2 and Bono, so I don't count that semester. Otherwise,
so minus 4 months. Okay.
Minus about 4 months.
50 and a half years.
Yeah, exactly. I've been black almost my whole life. And what I know is that almost anything bad that happens in our country happens worse to us. So this rumor that was going around saying that we're immune and we can't get it and it's just for older white folks, I was screaming very early, as you remember, this thing is going to hit us first and worst. Why? The numbers coming out of China and the numbers coming out of Italy, I said from the beginning, are never going to hold up in the United States in terms of age. Well, in China, you get 70-year-old people. In Italy, okay, it's 60-year-old people. It's an old folks disease. And then people in the United States said, well, people went to China were white. People in nursing homes are mostly white. So it's an old white disease. I'm young, black, and brown. I don't have to worry about it. I'm 25 years old. I don't have to worry about it. I'm 35 years old. I don't have to worry about it. I said, no, you don't have to worry about it, because in the fine print, they're saying underlying health conditions. I said, well, let me double click on that. Underlying health, what do you mean? Hypertension. Oh, well, hell. How many black people, including myself, have high blood pressure? Mm-hmm. How many people have to take a pill every day in the black community because of high blood pressure or diabetes? Or how many black people have an asthma inhaler in their pocket, or have a cousin or a nephew that does? All of us are going to be in very, very big danger. And now you're seeing black and brown people dying at 50 years old, at 40 years old, at 30 years old. So the media came out talking about old people, and put us to sleep. I was screaming, no. Do you take a pill every day? Are you supposed to take a pill every day?
Look, on this show, I will say I probably joked a little too long about black people not being able to get it.
Well, hey, listen.
But you follow the jokes with, no, that's not real.
And I even would say, look, if you smoke hookah every day, you have a pre-existing condition. If you're fat, you got a pre-existing condition. If you're drinking every day and you're having some liver problems or whatever, you've been doing that for a while, you got a pre-existing condition.
Hey, if I was a conspiracy theorist, I might go as far as saying that it seems like more than a coincidence that people running around saying black people don't get this.
Hey, listen, all I know is that today it is very, very obvious that this thing is hitting us really, really bad. And I'll say one more thing. You mentioned the thing, everybody got mad at Van Jones. Oh, he's working with Republicans. You know what's so funny right now, Ebro? Almost all those people are calling us now saying, hey, can you help us?
Yeah.
Because, listen, I'm a lawyer, but I believe in math. Let me tell you about the math. Most black and brown people are locked up in red states. In states that have Republican governors. Then once you get outside of New York State and get outside of California, the rest of us pretty much are locked up in Florida with a Republican governor, Mississippi, Alabama, Tennessee. These are places where if you can't talk to Republicans, you can't get black people out of prison. And so since I'm actually serious, we now live in a country, in our community, with this woke culture, I call them woke supremacists, believe in image over impact. As long as I say the right thing on Twitter, I've never got nobody out of prison. I've never won a case. I've never closed a prison, but I say the right stuff on Twitter, so I'm woke. So it's image over impact. It's rhetoric over results, okay? It's outrage over outcomes. I never subscribe to that. What I believe in is getting black and brown people out of prison. I will work with or against anybody to accomplish that. I will work with a Democrat or with a Republican. I'll work against a Democrat or against a Republican because people in prison can't vote. They ain't in no political party. They don't care who's in the White House. They want to come home to their mama's house. And if we don't put their needs first and let the world know, I don't care who you are, you're going to be won over or run over for our people, then it's just posturing and it's bullshit. And I challenge anybody who has criticized me, the Reform Alliance, or anybody else, show me the prisons you've closed. I can show you 5 I've closed. You say you're a prison abolitionist. I'm a prison abolitioner. I'm actually reducing prison populations, working with Jessica Jackson, Shaka Senghor, Topeka Sam, not just Van Jones. A lot of us working together, many of us coming from directly impacted environments. And when you work that way, you start to understand something about data and facts and logic. And this virus hates black people. This virus hates brown people.
It got to America and got so racist. Yo, it's like everybody else when they show up to America, immigrants to America, they get here and y'all hate black people every time you get here, man. Yo,
no matter where you're from.
Yo, be darker than black people and won't stop the cab.
Exactly. Drive right on past. But the reason why is because, as you were saying, brother, we are the ones who have been left out and left behind. So, we have hypertension and high blood pressure because it's stressful being black and brown. And then the doctors, et cetera, they don't treat us the same. It's harder for us to get the
food in our neighborhoods, the money in our bank accounts, access to everything.
So now what's going to happen, the right way to fight this virus is for us to get back to what we should have been about in the first place, which is wellness and oneness. We need to be focusing on health. It's got to be just as cool to be healthy as to be wealthy. We got every hip hop song talking about, I'm going to get so much money. I'm going to have this car and this jet and this helicopter and a NASA flight or whatever I got to do. But then they drinking all kind of crap in the background and they look fit, but you never see them drinking a green drink. You never see them doing a push up. We got to change the culture.
Well, that's because they still 22. Wait till they 42.
Exactly. Or 52. So we have to change the culture so that health is just as important as wealth, just as cool, just as sexy, and show the process of being healthy. And then also oneness. All our folk are working on the front lines. Who's getting these grocery stores? I haven't seen a white person in LA working outside their house in a month. Who's working at the grocery stores? Who's dropping these packages off? It's all us. And so now we're the so-called essential workers. We weren't essential 3 months ago when Bernie Sanders said, give everybody a raise. No, y'all should just work for nothing. Now they're gonna have to put up statues to nurses, statues to grocery workers when this thing is over, because we're the ones dying on the front lines, keeping America going. So when we work we have an epidemic of bad jobs, on the front lines, an epidemic of racism in the healthcare system, an epidemic of over-incarceration, when we're the ones in the housing projects. Hard to self-isolate when you're crowded in a housing project. Rich people self-isolate every day. They live in what we call gated communities. They live in big mansions, and they're already self-isolated. If you're at a housing project, a homeless shelter, a women's shelter, a prison, a jail, a detention center, if you're Black, brown, and poor, it's hard to self-isolate.
Well, that's one thing about poor white folks. A lot of poor white folks in this country, we talked about it. A lot of them live in rural spaces. Poor white America lives out in the sticks.
Yeah. And so they have a little bit of a better shot. And so, look, all I'm saying is it's been very, very interesting to me. A lot of people and groups and organizations that had criticisms a year ago before the crisis. And by the way, we got 8,000 people out of the federal system because of the First Step Act before this thing hit. 94% in the first wave were Black. 76% in the second wave were Black. But we don't do math. We don't go back and check the record. What I would say is going forward, a lot of those same people, quiet as it's kept, have been calling us. Can you get my cousin out? Can you help us with this bill? Can you connect us with this governor? And that's how it's supposed to be. Everybody's supposed to have a different role. Some people need to be out there yelling and screaming and getting the noise up. Other people need to be at the table trying to get the bills passed. And we need to stop criticizing each other in our different roles. You know, if I haven't name checked one person, I could. But I'm much more interested in us. Everybody, we have to be as sophisticated as the system we're trying to change. On the other side, I'm going to tell you, because I know them, they got some people who will be on the air saying one thing, somebody else behind the door doing something else, and they're all in the same meeting in the morning, and they talk to each other at night. They're very sophisticated on the other side. On our side, we blow each other up on Twitter, blow each other up on Facebook, jump on the radio, and make fun of each other to get chasing clout, chasing shares, chasing likes, and then we're weaker as a community when it comes time to get something done. I believe in results over rhetoric any day.
And that goes way beyond prison reform. That's like everything on the left feels that way. Everything from the election, everything we do is like that.
So let's dig in, Van.
Yeah.
You know, since you are an independent thinker and, Van Jones, a leader, who will you cast your vote for come November?
Hey, listen. As you know, I'm a lifelong, well, not lifelong. I've been a Democrat since Obama. Before that, I was Green Party and Peace and Freedom and anything else you could find. But I've been a Democrat since Obama. That's not going to change. I'm a proud Democrat. I've never voted for a Republican, never plan to vote for a Republican. So that's the answer to that question.
So did you see Obama's speech the other day? Or
you know what?
And I'm calling it a speech because it felt like, the bar is so low for presidents speaking that even hearing Obama just read off a teleprompter and record a message from his house felt like a presidential speech. Would you say, as an insider to what's going on in politics, that it feels like Obama's going to be right behind Bernie Sanders, being his consultant?
Behind Bernie?
Behind Joe Biden. Excuse me.
Yeah.
Hey, listen. The way I think about it is, if you're looking at the election as a Democrat, you got to think about this election as the Avengers versus Thanos. Okay, every Democrat, you can't just send Hawkeye up against Thanos. Okay, you can't just send one. You got to send everybody. And so, look, I think some people they like Biden, some people don't like Biden. Some people think he's ready, some people think he's not ready. It doesn't matter. If you're a Democrat thinking as a Democrat, every single person needs to be thinking, I'm running. I'm gonna do everything I can do. I don't care what the candidate says. I don't care. I'm running. I don't care if I'm a mayor. I don't care if I'm an activist. I don't care if I'm a TV personality. I'm running to have the future that I want. But yes, I think you're gonna hear a lot more from the Obamas and also from everybody else.
Van Jones, thank you for your time today. What's that site, Reform Alliance?
It's reformalliance.com. And listen, we are now trying to get, last thing, here's the key. Masks, tests, respirators. Everybody, I don't care who you are in your community, if you're going to be data-driven, I'm not playing the race card, I'm playing the data card. Data-driven, the hot spots are now in all Black and brown communities, and the hottest spots are in our jails and prisons. So if you have masks, they should be going to our communities. Tests, our communities first. Respirators, our communities first. And where do we not have masks and other PPE? where do we not have tests, and where do we not have respirators? Black and brown communities, especially jails and prisons. So if you're like, what should I do? What should I do? Be screaming on social media about that. Be screaming to elected officials about that. It's very simple. Where are the masks in our community? Where are the tests in our community? And where are the respirators in our community? And reformalliance.com with many of our other allies. Now, shout out to ACLU, shout out to NAACP, shout out Al Sharpton, shout out Mark Morial with the Urban League. Many of us are fighting to make sure that happens. Please, this is the time to put all beef to one side and stop this plague in our communities.
There it is. Van
Thanks,
Jones,
Van.
thank you for your time, man.
Thanks, Van.
Take care.
Thank you.